most of us here are doctors, and we need to appreciate that what we see as quality is different from what the patients see as quality healthcare. We are more focused on outcomes, whereas the patients are more focused on the processes of care and to ensure that they are actually safe in the environment where healthcare is provided. And we must not lose sight of this. What is also important is that there is the perception that providing quality healthcare has to be expensive. It is not. However, there has to be a cost to it. And in the words of one of our founders at Laggon Hospitals, Professor Mrs. Elebute, if you think quality healthcare is expensive, you should try the alternative. There are gaps in what we do, and the commonest from where I sit. Oh, by the way, I'm wearing two hats today. I'm the CEO of the Laggon Hospitals Group. We have 4 primary healthcare centers or primary healthcare facilities. I'm also the chairman of the technical committee for the Society for Quality Healthcare in Nigeria, where we've drawn up accreditation standards, and I will finish with that. One of the big issues with healthcare in our country today is communication, or more importantly, lack of communication, because we often do not carry patients with us when we are treating them. We do not explain our treatment plans. When we are going to do procedures on them, they are not informed, so a lot of us don't practice informed consent, which is very important. Not just the lack of communication between doctors and patients, but also between healthcare workers, between one healthcare to the other, particularly during vulnerable times, handover periods, when verbal communication is being given. All of those areas are prone to risks, and we must be aware of that. Next, of course, is medication management. And with medication management is the misuse and abuse of antibiotics. How many of you have been approached to give antibiotics for viral illnesses? And I do explain to my patients that for a common cold, if you give antibiotics, the cold will last for 1 week. If you don't give antibiotics, the cold will last for 7 days. You have to take your choice. The other one, of course, is the importance of high alert medications. And how many people in this country have died instantly from the injection of intravenous potassium chloride that has been mistaken for intravenous furosemide? Because the systems and processes are not in place, and these are very important. Infection control, of course, is extremely important. And this is one of the areas where it goes to show that you really don't need a lot of money to provide quality health care, because soap and water is very cheap. And the most effective way of preventing hospital-acquired infection is through effective hand hygiene. So I would recommend this to everybody. Now, there are opportunities to improve healthcare. Dr. Odubi spoke about checklist. Yes, the WHO checklist, at least for those of us who operate or are in the operating theater team, is essential. This was launched in 2008, and studies were performed in 8 different countries across all the continents of Earth. And what it did show was that the use of checklists reduced mortality by 50% and reduced 30-day morbidity by an equal amount, also about 45 to 50%. So now really, there is no excuse for any operating theater not to be using the WHO surgical checklist. It is simple, it is quick, and it is effective, so I will recommend it. Also, we need to adopt international guidelines and integrated pathways of care to ensure that we provide consistent care, because we may try, but often we cannot memorize all the pathways of care. Everybody has a mobile phone now, and you can easily download a lot of these guidelines and IPOCs onto your mobile phones. They will help you in providing good care. In terms of other opportunities, I will recommend to you to visit the Society for Quality Healthcare website, which is www.sqhn.org. And there you would see some of the things we do. It is instructive to know that the society was started in 2006 with a focus of improving the quality of provision of healthcare in Nigeria. And what we now do is we ensure that we train people, so we provide the capacity for quality healthcare. And how do we do this? We have what we call the Certificate for Introduction in Quality and Patient Safety. There are some handouts over there. And we also have an advanced course for quality improvement. But what we've recently done is to develop accreditation standards for hospitals. These standards were developed by Nigerians in Nigeria for Nigerians. And the whole idea of this is to ensure that we provide consistently good quality of care. We have piloted these standards and they are ready to be rolled out. What we are also doing is providing practicums so that if you are interested in the journey of quality and your hospital wants to be accredited, we will come and visit you. We will do a gap analysis for you, and we will then help you with practicums through a pathway in which you can then improve your quality of care and attain the accreditation. And I will strongly recommend this to you. Now, what are the things that we can do? Certainly, there is the issue of the Nigerian Bill of Rights, Patients' Bill of Rights, which were launched last year. I think that is very important because for the first time, we actually do have clearly laid principles of expectations of care for the average Nigerian patient. If you are a healthcare worker and you haven't seen that, I commend you to do so because the lawyers are looking at them. The other point really relates to leadership. And Dr. Odubiyi clearly showed that the driving force behind quality care in any facility has to be led by the person who is in charge. Because that is the only way you can carry people along. But it's important not for you to only own the vision. You should be able to share the vision and also ensure that the people who, your followers, also share in the vision. I think this is very, very important. And I think it is something that we need to ensure that all the leaders are trained in accepting that apart from ensuring that there are the financial health of an organization is fine, the quality of care is also very important. And both are linked, like Engineer Chidi said, that a healthy nation is a wealthy nation. Thank you very much.